Hi Jason. Today we're going to be talking about asthma puffers and asthma spacers and how patients can use them and care for them. By the end of this session, you will know how to explain to a patient how to use their asthma puffer and care for their spacer. So you can see we've got a PowerPoint presentation in front of us today, so this will be guiding us as we go along. And today, I just wanted to start by talking about the learning outcomes. So by the end of this session, the student should be able to explain to a patient how to correctly use a Ventolin puffer in combination with a spacer, using concise language which the patient can understand. The student should also be able to explain to the patient how to care for the spacer, using concise language which the patient can understand. So asthma is a chronic inflammatory disease of the lower respiratory tract that leads to acute episodes of bronchospasm, coughing and wheezing. So you may already know, Jason, from your previous studies that asthma management has a multitude of components. These are educating the patient and providing an asthma action plan, as well as non-pharmacological management such as identifying and avoiding triggers, and pharmacological management, which is usually with puffers. So there are many different types of puffers for asthma. Some are considered to be preventers or controllers, and others are considered to be relievers. Can you give examples of any that you know from your previous studies?
I know Ventolin, the reliever.
Yep.
And is tiotropium also a reliever?
Yeah, so tiotropium is more of a longer acting puffer, and not really used in asthma so much, but that's okay. So we have a big selection of puffers to choose from, as you can see. And as you said, salbutamol or Ventolin is a common reliever. And some preventers or controllers that you might have come across is fluticasone, which is flexitide, budesonide and formoterol, which is Symbicort, and fluticasone and salmeterol, which is Seretide. So there's different types of puffers which are available. You can see there's the one that looks like this, which is Ventolin. It's called a meter dose inhaler. And there's other devices such as dry powder devices and AccuHalers. And quite a few of these devices need a spacer to be used correctly as well. So the idea with a meter dose inhaler is you squeeze the top of the puffer and it breaks up the particles of Ventolin inside into small particles that can be inhaled. And the reason why we use a spacer is because it's very difficult to coordinate the squeezing action and the breathing required. So the spacer spaces out the Ventolin as it's ejected from the meter dose inhaler, allowing easier breathing and coordination. So our first part of today's session is we're going to be talking about how to use a Ventolin with a spacer. I'm going to demonstrate to a patient volunteer and illustrate some steps that you would talk to a patient about so they can learn how to use their puffer. And then I'm going to get the patient to explain back to me how to do that. And then I'm going to educate the patient on how to care for their spacer. And then once we go through all of that, I'm going to get you to do the same thing so you get some practice educating patients. Does that sound okay?
That sounds good.
Okay. Okay, hi Mr. Jones. So my name is Alec, I'm your doctor for today. And today I'm going to be showing you how to use your new spacer and Ventolin device. So, yeah. So basically, what I want you to do is when this is your Ventolin device and this is your spacer, the first step is to take the cap off the puffer like so, and then you put it into the back end of the spacer. And if this is the first time that you've used the spacer, you need to prime it. So you just shake it and then you squeeze it a few times. I won't be squeezing the actual Ventolin today to save the Ventolin. So you squeeze that 2 or 3 times, put it in the back. And then when you're ready to go, you take a breath out, seal your mouth over the mouthpiece here, and then you take a slow breath in after squeezing the puffer once. And that breath in should take 4 seconds. And then at the deepest part of your breath, or the breath in is just slow. And then at the deepest part of the breath, you hold it for 4 seconds. And then you exhale slowly, repeating that a total of 4 times. Sure. So 4 breaths match with 1 puff, and then you do 4 puffs in total. So that will be 16 breaths, or however many puffs your GP recommends. Do you have any questions at this point?
So just wanted to confirm, 1 puff,
Yeah.
take 4 breaths,
Yeah.
another puff, 4 breaths, another puff, 4 breaths, another puff, 4 breaths.
Yeah. Yep, that's good. Okay. Now I'll get you to explain back to me how you do it.
Sure. So, because this is the first time I'll be using an inhaler, I'll give it a bit of a shake to get it primed up, and then probably puff it out a couple of times. And then attach it to the spacer, like so. And then make sure I've got a good seal around the end of my mouth. And then press the spacer in. Press the puffer in. And take a slow, deep breath in, all the way sort of like 4 seconds or so. And then repeat that 4 times. And then after I've done the 4 breaths, then give it another squeeze, another 4 breaths, another squeeze, another 4 breaths, and finally 1 last squeeze, and the final set of 4 breaths. Is that right? Great.
Cool. And then you're done, and then you can just pack up your spacer and put the lid back on it. So next we're going to talk about how to care for your spacer. This is something that not everyone is aware of. You need to wash your spacer in a particular way so that the Ventolin is most effective. So the idea is you need to wash your spacer at least once a week, and you can wash it with lukewarm soapy water. So you would take the spacer apart, just taking off this mouthpiece, and just wash it gently in warm soapy water. Then the idea is not to rinse it with fresh water.
Oh, is that right?
So you just wash it with soapy water only, and you don't dry it with a tea towel or anything. You just put it straight on the draining board and you let it drip dry. And this leaves a thin film of soap on the inside of the Ventolin chamber, and just stops any Ventolin from sticking to the inside of the chamber when you're using the puffer, so it maximises the amount that gets to your lungs. Does that make sense?
It's like an easy version of doing the dishes.
Yeah, so no drying, no fresh water, just soapy water.
Wish dishes were like that.
Yep, and people often have a second puffer because it might take a few hours, a second spacer because it might take a few hours for the spacer to dry. So do you want to explain to me how you would clean your spacer?
Sure. So basically, kind of like as I mentioned, like doing the dishes, I suppose. So take it all out, pull it apart, wash it with warm soapy water. But don't rinse it with tap water after that. And then once I've washed it, then just keep it on the drying board, just let it drip dry. And then after a few hours, once it looks dry, it should be good to go for another use. And do that about once a week.
Okay, Jason, I'd now like you to explain to Mr. Jones how to use his puffer.
Hi, Mr. Jones. Nice to meet you. I'm one of the student doctors here at the hospital.
Another one.
I've been asked to explain to you how to use a Ventolin puffer, if that's okay. So,
I have no choice.
So this here is your Ventolin, and as well as the spacer that comes with it. So the Ventolin acts as your reliever. So when you're having, I guess, for that chest tightness, when you feel like your asthma's not being well controlled, this is what you use to relieve those symptoms that you're having. So how do you use it first? You want to give it a few good shakes. You want to take off the cap, and then there are 2 methods that you can use after this. You can use it via the puffer by itself, or preferably you would carry this lovely spacer here. And the reason that you want to use the spacer is because it delivers, I guess, a higher proportion amount of the medication from the same puff. I think it's over double compared to just using something like that.
So you recommend using this?
Oh, definitely. I definitely recommend it to all my patients. And so how you put on the other way, my bad. How you put on the puffer to the spacer is you insert it into the side as shown. Push it in. Good. And afterwards, you would insert it into your mouth, like this. Obviously inside your mouth. And then after you've shaken it, as you give it a squeeze as you're taking a deep breath. And then you breathe out.
Into the puffer.
So into the spacer, you take a deep breath in as after you started to squeeze it down, and breathe out, and then do that 3 more times, and then puff a total of 4 times. So every puff that you do, you breathe in, and then you breathe out
Yeah.
4 times, and you do that 4 times within a cycle.
Sure. And it's okay to breathe out into the space.
Yes, but preferably be breathing out the urine. But if that, some people find that challenging, I know I
Sure.
certainly do. So you can breathe out the urine out if you find that more comfortable.
Okay.
Good. And then I'm also have to teach you a few things about caring for your spacer. So not many people know this, but you actually have to wash your spacer. And do you have any ideas how you would wash it?
Just from the dishwasher.
Not quite. But you're still on the right track. You can't just rinse it with
Obviously.
water firstly. You need to do it a bit the old-fashioned way, so sort of that soapy water. So what you want to do is take it apart, run some soapy water inside it, give it a good scrub, and then just leave it to drip dry at the end. So don't wipe it down with a cloth. Just let it drip dry in the back.
Okay.
And that's how you care for it. And
But
you should be
don't
doing
even rinse the soap off it?
No, you leave it there.
Oh.
Yeah. Because they found if you try to wipe it off or rinse it off, you're basically negating the benefit of washing it.
Okay.
And just to make sure that all made sense to you, do you mind explaining how to use the puffer to me and how you take care of it?
I can, if that's a good go. So, because I'll be using it for the first time, I just want to give it a few shakes to prime it up. Get rid of the cap at the front. Attach the puffer to the spacer, like so. Put this end of the spacer into my mouth, make sure there's a nice seal around the edge. Press the puffer down and take one slow deep breath in, and then breathe out. Repeat that another 3 times, so to another 4 breaths per puff, and puff, do another puff, another 4 breaths, another puff, another 4 breaths, finally 1 more puff, and then final set of 4 breaths, and that should be it for 1 cycle.
Yeah, absolutely.
And then you asked for how I would care for it, so about to wash it off, so I would probably just take it all apart, just wash it with warm soapy water, but not to rinse it with fresh water, and then just sort of keep it on a drying rod and just let it drip dry, and then that should be good to go for next time.
Yeah.
Does that sound about?
Yeah, that's absolutely right. Thank you so much for your time.
No problem. Pleasure.
So we're going to go through some feedback now. What do you think went
Well, I think I got the overall message across. I think I was able to educate Mr. Jones how to properly use his puffer.
Yeah, I agree. And what do you think you could have done better?
I feel like I was just a bit I think I was just a bit unfamiliar with just the spacer itself and how to use it. I mean, it's the first time that I've used it, so I'm not sure if you know. I was a bit struggling about which end to insert the puffer itself.
Yeah, I think it seemed like perhaps you weren't super familiar with the spacer and perhaps some of the recommendations, like whether to breathe out through your nose or into the puffer. That's okay. We can work on that definitely. So let's make an action plan on what you could do to improve over time. What are some things you would like to include in an action plan?
I guess I'll make myself more familiar with the equipment. Absolutely, and I guess familiarizing myself with medication, because like you said during your presentation, I got a bit mixed up that titration. I thought it was a reliever and it wasn't.
Okay, so basically more reading about medications and more use of experience with the puppers. Okay, that's good. So to summarize, you feel like you explain things quite well in a structure to the patient, and you'd like to work on perhaps your practicing with the equipment and do some more reading on the puppers. Does that sound like a good plan?
Yeah, it sounds
good summary. Okay, all right, great.
Thank you.